is 18 minutes past 8. Chetan's going to bring us up to date with the sport. There are some big battles going on in the world of football, so he'll bring us up to date with that a little later.
Really busy weekend ahead. 19 minutes past 8. The charity Help for Heroes says many veterans living with chronic pain are not receiving the compensation they deserve from the government.
And it's calling on the Ministry of Defence to recognise the condition in its own right and to expand financial support for those who are affected.
Well, ministers say they're continually reviewing policies. They owe a debt of gratitude to all veterans, as John Maguire now reports.
Vicky Ross lives her life in constant pain. Always active and fiercely competitive, she plays wheelchair rugby, which you may be amazed to hear helps her to deal with the pain. It's a distraction, but not a cure.
Is there ever a time when you're not in pain?
I don't think so, other than when I'm on the operating table. So, yeah, everything hurts at some point, yeah. Especially my knees and my feet, and then kind of in my shoulder as well. But just depending on what I do through the day, so whether I'm sitting down too much or whether I stand up too much or whether I walk, you know, that increases the pain and it increases the time to recover back to that kind of baseline of pain.
She had a very successful military career but was medically discharged after 22 years. The army had followed playing football for Manchester City. A lifetime of sport and physical endurance has taken its toll. And despite the scars, she says chronic pain affects her life in so many ways.
The kind of mental health impact it has, you know, it just makes everything a lot more difficult. So it makes, you know, socialising difficult, it makes work difficult, and then, you know, you start to doubt yourself. So even when you have this pain, it changes your life, it changes the person you want to be. You know, that has its own kind of mental health impact.
She's backing the campaign by Help for Heroes, a charity for the armed forces, to have chronic pain designated as a medical condition in its own right.
It's one of those, I guess, disabilities that you can't see and people just don't understand. So it has a huge impact on your life. Not just your life, then if you look wider, your family, your job, how you are as a member of society. It can be crippling for some people.
Having achieved so much in her personal, professional and sporting life, Vicky's determined to continue being as active as she possibly can. And when chronic pain is doing its utmost to defeat her, that determination is this former soldier's most valuable weapon. John Maguire, BBC News, Staffordshire.
Well, we're joined now by Karen Jameson, who's a Veterans Community Nurse, morning, with Help for Heroes, and also with us Dr Liberman, who's an NHS consultant in pain medicine. Morning to you too. Karen, let me start with you here, because we said there, this is about designating chronic pain, isn't it, as a properly official medical condition. But there's a lot more to it. Just talk us through why this is so important.
I've been a Veterans Community Nurse now for 2 years with Help for Heroes, and I work with veterans, and I didn't realise that chronic pain could be as debilitating as it really is. I go and see the veterans in their own home, and seeing these young men and women, which predominantly they are, actually having to work out how they're going to get to the bathroom. They don't enjoy family life anymore. They don't go out. The only time they leave their home is to go for medical appointments. So trying to support those veterans in getting the recognition, because it's very easy to get compensation if you've lost your limbs in war. So we want this one recognised because it is debilitating. It's heartbreaking seeing how some of these guys and girls are living.
Dr Liberman, there is a problem here, isn't there, though, when it comes to diagnosing chronic pain? I mean, you think of all, you know, it's a term and then all these other conditions are put under it. And it's really difficult to pin it down and say, this is an issue, you have a diagnosis.
It is and it isn't. I think that when you see people with chronic pain, it's a bit like a piece of art. You recognise it when you see it. And the incidence is high. So in the general population, as you know, about 30% of the population have chronic pain. Pain is an experience of life. It's a sensory experience. And so to say that we're never going to have pain is unrealistic. But there is a high incidence of intrusive chronic pain. So intrusive chronic pain probably runs at about 5 to 8% of the general population. And intrusive means that it really intrudes into your daily living functions. So you need help putting your socks on, you need help getting washed and dressed, you need help with cooking and food preparation, or things that the rest of us take for granted, as Karen said. So when you see people in a chronic pain setting, what should happen is you should have a full biopsychosocial assessment. So you should be able to sit down with a clinician who's trained, and for them to understand the journey that someone's been on to when they see me in clinic. So when I see people first time round, I'll sit and talk and listen to them, most importantly, to understand why they're presenting to me. And it's threads of things that come through, maybe from their childhood, maybe from a problem at work, maybe from a problem in the family, maybe some trauma, maybe some disease. And then it's understanding how all of that has then formed into their presentation and why they're sat in front of me, because pain's a sensory experience and it's an emotional experience. And the definition of chronic pain is it's a biopsychosocial problem. So, for example, if someone said to someone, look, the next time you get pain in your chest, it's because you're having a heart attack, you're going to think and feel and behave very clearly about that pain. If someone says to you, look, we've looked at your heart and your coronary blood supply is okay, and the likelihood is your next bit of chest pain is because you've worked a bit too hard in the gym, immediately you're thinking about the pain differently. So how people contextualise, understand, and have that model of pain explained to them is really super important.
The impact pain can have, that chronic pain can have, Karen, and you'll know this, is desperation.
Yep.
I mean, you've had veterans who've said, just get rid of these limbs.
Yep. I have veterans that I work with that when I first see them, and obviously I'm saying, right, what is it you want from this clinical assessment? And they said, Karen, please, can you get a doctor to chop my legs off? And I'm like, that's not my gift to give, but let's find out a cause now. Let's try and see what's going on. So I will work with them really, really closely. I contact their GPs, and then we get them on our pain course and things. And we really need to recognise this because it is debilitating.
We've had messages from our viewers this morning, and someone said, I broke my tibia plateau at a charity event 6 years ago. It's so bad that I begged my surgeon to amputate it, as I believe I'll have a better quality of life as I'm only 40. Now, making those decisions, they're not easy decisions.
That's tricky.
Yeah.
So the classical thought around amputation and pain is that, unfortunately, you swap one type of pain for another. So if you take a limb off, you risk having the same type of pain experience, but with phantom on top of it. And phantom pain's really about the brain thinking that you still have the limb and searching for the experience and not experiencing the right feedback from the limb. And then the other areas of the brain that are associated with sensory experience overgrowing into the area that was associated with your limb. So it's quite complex. And phantom pain's a terrible pain to have. It's a lifelong pain. And the fear that doctors have is that the simplistic idea is you chop something off and so it's going to get better. And actually you replace one thing with the same problem and then a whole load of other issues. And that's the concern.
And Karen, what happens if this isn't dealt with? Because the numbers are staggering. I was really surprised by these. 78% of veterans that have long-term health conditions that have come to you for help and the charity have long-term pain. Chronic pain affecting 15.5 million people. If it's not dealt with properly, what happens in the longer term?
What we're hoping... Obviously, healthcare is evolving continuously. We need an awful lot more research. We were talking about this in this field. We absolutely need that. In the meantime, we're going to support them the best that we can at Help for Heroes. But financially, these guys and girls, it's not that they don't want to work, they can't work. So this is why our campaign is like it is, to try and get the recognition, so to help them and recognise this.
And it's that thing, I mean, a description here, imagine you have raging toothache, earache, all at the same time, how that affects your ability to think, interact with the world around you, those you love. I would consider that a good day, says John, who's messaged in. One viewer saying, been in chronic pain since the 1970s. I can't even remember a time of not being in pain.
How do you not fix, but treat someone like that? And why is there someone who's been in chronic pain since the 70s?
Because, OK, so if you divide the issue up, the first part of the issue is a recognition in our healthcare system that this is a significant problem. So we've got lots of of groups of people out there who have unmet needs with chronic pain. So if you take fibromyalgia, that's 5% of the female population aged between 18 and 65. And intrusive fibromyalgia is probably about, 0.5 to 1%, but it's only 0.5% of men that have fibromyalgia. So there's a sex discrepancy here. And there is a whole set of things that need to be put in place to help the population. So you first of all, you start off with the point that you can't cure chronic pain, okay? But you can help people live with it and you can help people have functional lives. And for example, there are about 500 full-time equivalent pain doctors in the whole country. So there's only 500 of people like me for the whole population. And of people like me who work full-time in chronic pain, there's probably only about 120 of us for the whole country. So, I joke with my kids and I say, look, there are fewer people doing my job than there are doing Premier League football jobs as footballers. So it is about where we want to spend our resources. Within the service that I work in, I'm just one part of a cog. I work with psychologists and nurse specialists and physiotherapists, and ideally we would be working with dietitians and we'd be working with health coaches. So there are things that we could do that would make a huge impact. But the reality of managing chronic pain is that it falls between the DWP for the benefit side of stuff, social care and health care. And when you spend money that may be funded by the healthcare part of the system but is benefiting the DWP or the social care, the interagency difficulties preclude us having a really grown-up map of what we should be doing. So I think the first step is to recognise it, and it's fantastic that we're on BBC Breakfast to sort of highlight the issue. I think for the vets, we could certainly do small things like highlight through the medical EPR systems the fact that they have served and that they, the government could easily put a target on their waiting time and their prioritisation. And, in the States that happens. So in the States, if you've served, you go into the VA and that's your healthcare system and it's recognised. We don't do that here. But for our general population, we just need a lot more training of our healthcare staff, and we need more healthcare staff to look after people with chronic pain.
The Department of Health has said that there are NICE guidelines which describe best practice, should be taken fully into account into the care and treatment of individual patients. They're not mandatory. They don't override a medical practitioner's clinical judgment, just taking a look at the guidance on pain. And the Ministry of Defence, just for a right of reply, has said service personnel and veterans who believe they've suffered ill health due to service from the 6th of April from 2005 have the existing and long-standing right to apply for no-fault compensation under the Armed Forces Compensation Scheme, also adding, we hugely value our service personnel and veterans and owe a debt of gratitude to all those who serve. We could talk a lot longer about this, I am sure, but it's an issue that, as you've clearly made out, it clearly said, it's worth bringing up, and it's something that we will follow up definitely and keep an eye on. Thank you both so much for your time with us on the sofa.
Thank you.
Thank you very much.
Thank you. Thank you too as well for all your comments. Keep them coming in. Really useful as part of that conversation.